Medical research is an essential component of medical practice and has been responsible for great advances in healthcare outcomes. However, we must recognize that research can also potentially put patients at risk, and we must therefore uphold the highest standards of research ethics at all times. First and foremost, we must do everything possible to ensure patient safety, and we must submit and receive approval from the relevant Research Ethics Committee before any clinical research commences. If patients are participating in research studies, they must be fully informed and give consent freely and without duress, with a clear understanding of what the research involves, what the possible risks and outcomes are, and what the alternative treatment might involve. They must also be informed of the possibility of being given a placebo, which would have no effect on their disease outcome. Patients must always be assured that refusal to participate in a research study will not adversely affect their care. All data generated through research studies must comply with the Data Protection Acts, and patient research data must be treated with the same confidentiality as all other clinical data. Payments to doctors for participation in research studies by pharmaceutical, medical device, or other commercial organizations can give rise to real concerns about conflicts of interest and should be treated very cautiously. Any such payments must also be disclosed in presentation or publication of research results. If tissue removed during an operation or other procedure is used for research purposes as opposed to routine histopathology, the patient should give consent in advance, and we should seek permission from the local Research Ethics Committee. Now take some time to consider the following. In medical research, as in medical practice, most studies and interventions involve risks and burdens. How can we as doctors reconcile this with the principle that, in medical research, the well-being of the individual subject must take precedence over all other interests?